You're listening to the Monday Night Community Show with Daniel on BRFM.
We'll be starting this hour with our regular slot with the Swale Clinical Commissioning Group. We're firstly going to be speaking to Karen, and we spoke to Karen last time we did our little slot. So firstly, thank you very much for coming along and speaking to us once again.
Thank you for actually having us come here. It's great.
Now, I was wondering, now you're back, if we could do a little bit of an introduction into what you do at the Swale Clinical Commissioning Group, a bit of a reminder.
Certainly. If I just sort of do a quick reminder what the commissioning group does, and then I'll talk about what I do. The commissioning group was, I suppose, part of the restructuring, that the government did, and it reorganised how we pay for services. And they wanted it to be much more local. So what the commissioning group is a local group, mainly of GPs, but it also has other clinicians like nurses and specialists who are part of the board. And they look at and decide how we're going to spend the money we get on the health services we want. And also what they do is they go out and they talk to people as well. So we also get sort of community and patient feedback. So we're looking to tailor the services to the needs of the community much more than, say, the big groups that used to be there, which were known as the primary care trusts. As part of that, when we looked at what was important in the Swale area, one of the things is looking at, I suppose, what's called life expectancy, how long you're expected to live. And it was noticed that there was a big difference between the richest areas and the poorest areas, especially in Swale. So, for example, in some of the richest wards, you would live to, say, about 82. In some of the poorest, it was noticed that people were only living to about 72. Now, it's only an average. It doesn't mean you die at that age. It's just an average. And we wanted to have a look at that and do something about it. So that's what I do. I'm in charge of a project looking at health inequalities. And we looked at what are the main reasons why people die earlier in the poorer areas. Partly it's about preventable diseases like heart disease or lung disease, diabetes, things like that. And also about the difficulty, I think, for people in poor areas to actually be able to do activities and get the support they need for healthier lifestyles, that kind of thing. So that's why I'm here, to work with communities to actually improve that. And mainly I work with GPs.
And the last time you were here, we was talking about an event you were organising at Laysdown.
Yes, we went down to the Children's Centre, the Sure Start Centre at Laysdown, and we did our health MOTs. And we actually had a really nice day. We had quite a few young mothers and kids come in. And basically what we do is we provide a sort of free test looking at people's blood pressure and their pulse, and giving them a cholesterol test and a glucose test. So the glucose is to see whether or not maybe they've got slightly high blood sugar, which means they might have some issue, maybe being pre-diabetic, which means they're not they haven't got diabetes, but they're heading in that direction. So it's a good way of catching things before maybe they become serious. We actually had, it was an interesting day. We actually had a very warm welcome from the area. We would love to do something there again. I think it would be nice to actually be able to do something with the wider community there. And I think we're going to have conversations there with the various groups and see what we could do, because it was lovely being out at Laysdown for the day.
I know you've got an event coming up that you wanted to cover next.
Yes, we have put together quite a big event down at Queenborough, as well as doing the health MOT. So anybody can come down, get themselves checked over, make sure they're nice and fit and healthy. And also, as well as doing that, they can come down and they can sort of explore and get a taster of things like the Bollywood dance craze Just You, or maybe even try a little bit yoga or Tai Chi. Or if they're feeling wonderfully fit and energetic, they can take the Firefighters Fitness Challenge, which is normally quite fun. We've also got information for about the local allotment group that they might want to join, and possibly maybe even connecting in with the local Healthy Walks group. It's about all different kinds of things. Some of them are going to be groups that you would pay for and do do things with, like the Tai Chi. Some of it absolutely free, like finding out about the free gyms that are over in Queenborough, I think on the seafront, and how to use those. As well as that, we're going to have members of the Queenborough Rowing Club there. So should you be feeling extra fit and energetic, you can find out about them and maybe how to join them as well.
So do you think people are going to be ready for this in the area?
It does sound a little bit like, we sort of want everybody either going for the next Olympics or possibly the next sort of, Strictly Come Dancing, but it's not. It's about, I suppose, looking and seeing what's around you and making a little change. The healthy food tips, it may be changing a little bit of your diet. Healthy walks, you might think, okay, fine, interested, and maybe look at doing a healthy walk once a month, once a fortnight. It's about doing something that starts changing how you do things. It's improving your health so that you then avoid having things like heart disease, diabetes, that kind of thing. And it's a step at a time. It's not changing your whole life in one go. It's just doing one little thing and seeing where you go from there. And the really nice thing about this is we do have people there who can support you. So for example, we've got Slimming World coming down, and we also have the health trainer service who are there to support people in actually achieving their goals and the projects that they set. So it's not like you've got to do it on your own, and you can come down, have a chat. If you don't want to do it, you don't. But if you want to find out, have a fun afternoon. We would love to see you. It would be great.
I know we were sort of talking about a particular sort of area just a minute ago, and I was wondering, is there anything you can take away with you when you attend one of these events? Yes,
it's all well and good coming along to one of these things, but it's actually quite nice to be able to take stuff away with you. We have recipe books that you can look at. We have activity walks, local information, and also, when you do take the health MOT, you do actually have a passport that you can take with you, which gives you your results and what they mean. So you can take that with you, so you can see where you're good, where you're bad, and gives you an idea of what you maybe want to do. Also, if you want to do something about it and you're thinking, I'd like to make one change, we can also give you basically a sort of health targets leaflet, and you can look and decide what you'd like to do. If you want some support with it, we can give you support, and it gives you information of local activities, local support areas in the Swale area, as well as providing you with some ideas about maybe where you'd like to make a simple change, maybe about eating, exercise, smoking, maybe even drinking.
So are there any specific health messages you would like to highlight?
Yes, I think we talk a lot about heart and lung diseases, like heart disease, things called COPDs, which are things like bronchitis, things like that, which are really not good for us. But one of the things I think maybe we miss sometimes is diabetes. And on the 14th of November, it's National Diabetes Day. It's a perfect time to highlight diabetes, what the signs are for diabetes, and looking at how we can change our lifestyles so that we don't get diabetes, because certainly diabetes type 2 is preventable. We don't have to get it, but we all need to change bits about our lives so that we can get healthier and we can avoid that possibility.
And we're now going to be speaking to Hilary, and Hilary is a diabetes specialist nurse, and she was also diagnosed with diabetes type 2 10 years ago, and I've no doubt Hilary will be talking about that. But firstly, Hilary, thank you very much for speaking to us this evening.
Thank you for having me.
So why should we worry about diabetes then?
Well, diabetes is actually on the increase across the world, hence the importance of things like World Diabetes Day. It is the biggest challenge facing health services today, with approximately 3 million people with diabetes in the UK, and experts do predict that the numbers will rise by 20 to 30% in the next 10 years, so it's certainly on the increase. In Swale, we share the highest rate of diabetes in Kent with Thanet, and there are 6.6% of people with diabetes. In Swale alone, there are 5,459 people diagnosed with diabetes, but we do believe that there are possibly another 500 that are not aware that they have their condition and are awaiting diagnosis. Swale has the highest rate of diabetes-related emergency hospital admissions as well in Kent, which is quite alarming.
Hilary, what is diabetes?
Right, diabetes is a lifelong condition which allows the blood glucose levels to become much too high, and if they are not treated, these blood sugar levels, then it can lead to other serious problems, including heart disease, nerve damage, blindness and loss of limbs. And diabetes is actually the leading cause of blindness of working age people in the UK, and it is also a major cause of lower limb amputation, kidney failure and stroke, so it can be very, very serious. There are, however, two types of diabetes. Type 1 diabetes, which is usually diagnosed in a younger person, and it's where the body isn't producing any insulin of its own at all, so there is nothing there to be able to control the blood glucose levels. About 10% of people with diabetes have type 1, and it is treated by daily insulin injections or an insulin pump. Type 2 diabetes can also be known as insulin-resistant diabetes. It is far more common, and it is estimated that about 90% of people with diabetes have type 2. The body does not produce enough insulin, or the insulin that is being produced isn't working properly, and often can be controlled just by eating a healthy diet and taking exercise. However, it is a progressive condition which will eventually need medication in the form of tablets or injections. It is often associated with people who perhaps are overweight, and tends to be more common in the older person, so that is over the age of 40. Certainly type 2 diabetes can be helped with a healthy diet, physical activity and prescribable treatment if required.
How can people tell if they have diabetes, Hilary?
Well, interestingly, that is one of the biggest problems, because sometimes there aren't any symptoms at all, or the symptoms may be so mild that they put it down to something else. So that's why it's important to go along to either GP screening or one of Karen's events to find out a little bit more about whether you could have diabetes or not. However, some people might start to feel thirsty. They might need to visit the toilet more often, particularly at night. Or they may feel tired, and sometimes they experience unexplained weight loss. Another sign can possibly be blurred vision, or if you have a wound, a cut or a blister, it might take longer to heal. So if you have any of these symptoms, it's worth seeking further medical advice.
Now you're letting us know that you've got diabetes too. So how did you feel when you were diagnosed, and what do you have to do to manage it as well?
Well, interestingly, being a diabetes specialist nurse, I didn't actually think that I would ever develop diabetes. However, I was very overweight, so that is probably one of the reasons why I did. I coped with it pretty well, really, knowing all the information that is available. But interestingly, I did not have any symptoms whatsoever. I diagnosed myself by doing a blood test, which I often do to show patients how to do blood testing. I did a blood test. It was a little bit high. I was a little bit concerned, so I went to my GP, who did some further tests and diagnosed me with type 2 diabetes. I am reasonably well controlled on diet and exercise, but I do take one tablet and also one injection, which isn't insulin, but I do take an injection on a daily basis. And I'm reviewed regularly at my GP surgery for my control, and I try to maintain a healthy lifestyle as well.
Our last question with Hilary is asking, are some people more at risk?
Yes, definitely. If you have a family history of diabetes, particularly type 2 diabetes, then you are more at risk of developing it in the future. As also ladies that have diabetes during pregnancy, which is called gestational diabetes, they are more likely to develop full-scale type 2 diabetes later on in life. Also, if you have high blood pressure or have had a heart attack or a stroke, you can be more likely to be at risk. And also, if you're a lady and you have a waist of more than 31.5 inches, and for a man it's more than 37 inches, then again that risk of diabetes is accelerated by the fact of your waist measurement. It's also worth mentioning that if you are of an Asian background, and again, an Asian man with a waist measurement of more than 35 inches, then you should take special care and try and lose weight to avoid developing diabetes. However, if you feel that you may have any of the symptoms of diabetes, any tiredness, thirst, or passing urine more frequently, have a family history, have had diabetes during a pregnancy, or are overweight with a particular waist measurement, then if your GP invites you into a clinic to be tested, there are health checks which now are carried out between the age of 40 and 74, which you can go along and have a blood test to see if you do have diabetes. If you don't fit into those age groups but think there may be a reason why you have diabetes, then I would encourage you to go and see your GP. And it is a simple blood test that will be able to diagnose whether you do have diabetes or whether you are at risk of developing diabetes in the future.
Hilary, would like to thank you very much for covering all those things.
Thank you.
And we're going to be talking to John next, and John is the spokesman for the Swale Clinical Commissioning Group this evening. So, John, it's good to speak to you.
Oh, it's wonderful to be here.
So, John, how can people get involved in healthcare in Swale?
Well, as Karen explained earlier on, Swale Clinical Commissioning Group came about in April to actually make health far more local, and it involves local GPs. But what we also need is the input from the public, and particularly your listeners, to find out what we're doing right and what better we can do. Now, twice a year, the Clinical Commissioning Group has what we call a commissioning intentions event, which is a very grand name for sort of a public meeting where we invite everybody in who has an interest in health, and they can talk and explain what they'd like to see. Now, our next one is a very important one, and it's a great opportunity for listeners to come along and help. It is on Thursday, the 14th of November, which, as you heard earlier on, is World Diabetes Day. And again, it's at the same venue that Karen's event is, which is at Castle Connections next to Queenborough Library. So we're holding that Thursday, the 14th of November from 10 a.m. to 2:30 p.m. And the result of that is, or the reason, is NHS England, which sort of looks after the health of the entire sort of country, has asked all clinical commissioning groups to take a hard look at the services in their area and to see how the system can be made to work more efficiently. And this will mean combining some services to avoid duplication. I mean, one of the most frustrating things that your listeners have probably mentioned in the past is that sometimes with the NHS, because it's a large organisation, you end up repeating your story to similar different people, and what we're trying to do in Swale, we're sort of leading the way to try and integrate that and to make it seamless and to make it one easy system. So we're looking at that. We are combining our sort of community services, but to do that we need the help from the public, so that we actually end up doing what they need. And listeners can come along and take part in this. Now, it is free, but because the spaces are limited, they will need to book their places in advance. And I can tell you the details now. You need to phone a lady called Lisa Blumson, and she's on a Canterbury number, but she does work for Sittingbourne and Sheppey. She's on 01227 795 040. So it's 01227 795 040. Excuse me, or you can email her at l.blumson, which is BLUM for mother, S for sugar, ON for nut, at nhs.net. And we'd really like to hear from everybody who's welcome to come along.